everyone, I'm Dr. Diab, and on today's episode of Just What the Doctor Ordered, I'm going to be talking about flashes and floaters. Floaters are a common symptom that people often have in their eyes where they see little blackish or grayish colored dots or spots that kind of float around in their eyes. Sometimes they can see them all the time, or sometimes they're only when you look at a bright white wall or into bright light, or focus on them or look for them. And they usually move when you move your eye. And another symptom related to that is flashes. And these are like little lightning flashes or small white lights that you see often in one of the far corners of your eye. Oftentimes people only notice those at night, but sometimes they'll notice them in the daytime. When we become concerned about floaters is when they come on suddenly. Usually this will occur only in one eye. If you're having them in both eyes, it oftentimes will indicate a different type of problem. But if they come suddenly in one eye, you may have one large floater or many floaters, or a large one and many small ones. And people often describe them as spiders or bugs, or they think there's a fly in the room. So when that occurs suddenly, then that is definitely an indication to see the ophthalmologist for a full dilated retinal exam.
In that case, you are most likely having a condition called a posterior vitreous detachment, where the vitreous gel, which fills the back of the eye, is pulling away from its attachment to the retina of the eye.
Now, the question often arises, how much time do I have before I need to see the doctor? I would generally recommend within a couple days of having those new symptoms that you go in. So if it's a Saturday night, you're probably not going to have a lot of benefit by going to an emergency room. It may be better to wait until first thing Monday morning to see the ophthalmologist. That's in the case of just seeing some new black floaters in your eye. Now, if those are accompanied by light flashes, as I mentioned before, then that can sometimes be more concerning. So floaters accompanied by light flashes do have more urgency with them in many cases. And then the sort of worst case scenario would be if you're not only having floaters and light flashes, but you're also seeing a dark part of your vision. So maybe the upper outer corner of your vision looks like there's a dark curtain over it, or there's just a black area where you feel like you can't see. That is definitely an emergency, and in that case, even if it was on a Saturday night, I would probably recommend you do try to get evaluated, even if that involves going to an emergency room, because that could indicate that you're having a condition called a retinal detachment. So that sort of gives you a sense of the urgency when it comes to flashes and floaters. I generally do like to see everybody who has new floaters, new flashes, and dilate their eyes, and just make sure that they don't have a problem in the retina, which is the back layer of their eye, such as a new retinal tear or a retinal detachment. A retinal tear can be treated immediately with a laser treatment that we do in the office. However, a retinal detachment is often more serious and will require referral to a retinal specialist, most likely for a surgical repair. And there are some other types of treatments for it as well. If you do have symptoms like this, please do get evaluated by an ophthalmologist. Everything that I'm saying today should not be construed as medical advice, but just general information. It's always best to see the ophthalmologist and have a full exam and evaluation done. Thank you.